All right, folks, I'm going to try to teach you all about anemia in a few minutes. This is a busy slide, but basically everything above this line represents how red cells are made, and below it is how red cells are lost or destroyed. This is the part above the line showing how red cells are made. Iron, B12, and folate are the three main building blocks of a red cell, the bricks and the lumbar and the mortar, if you will, which enter the blood factory or the construction site, which is the bone marrow. The kidneys also play a role because, like any construction site, there needs to be supervisors, unless you're the cable company in my neighborhood, in which case you send 4 supervisors. So the kidneys make a hormone called EPO, or erythropoietin. Its most common trade name is Procrit. Remember, hormones are chemical messages sent from one organ to another, in this case from the kidneys to the bone marrow. So if your iron, B12, and folate are all in order and the kidneys are fine, making enough EPO, and the blood factory or the construction site is not being impacted by something like an earthquake, a hurricane, or a tornado, cancer, leukemia, or lymphoma, a red cell will come out of this whole kit and caboodle. Red cells should normally last about 3 to 4 months unless they're lost or destroyed. The most common cause of loss is normal menses, a woman's period, and GI blood losses. The upper GI tract, we see gastritis, ulcers, and occasional cancers as the cause. The lower GI tract, we see diverticular disease is the most common cause, but polyps, which can become cancers, as well as hemorrhoids, can also be common causes. Lastly, there's red cell destruction. This is a very challenging thing sometimes to figure out, and includes people who have artificial heart valves, certain drugs, certain cancers, or even autoimmune diseases which can cause antibodies. These are all rare situations, and this is when you need to call hematology if you suspect something like this. So that's it in a nutshell. There's the first slide all over again. Once you know this, you'll know 90% of the causes of anemia.